Hello, everyone. I'm Trish Grooms, and I work as a school counselor at the Texas School for the Deaf. I've been here at the school for roughly 17 years. I do want to let you know that before I get into today's webinar, that there will be information available on the website, including references, links to resources, examples of forms, and other information relevant to the presentation. So do know that you will have access to those materials. I want you to know that in Texas, we need to increase awareness of trends and what has been going on across the state. Texas recently passed a law, June 19th of 2015, referred to as the Jason Flatt Act, which is House Bill 2186. That was passed in memory of Jonathan Childers of Fairfield, which is in northern Texas. The reason behind passing that law was due to the numerous incidents of suicide occurring. And Texas felt that it was necessary to have some type of act in order to help bring awareness about suicide. The purpose of that act was to ensure that all districts in the state of Texas had increased awareness of suicide as well as how to prevent suicide. Suicide is the second leading cause of death amongst young people ages 10 to 24. This act helps emphasize the importance of enacting policy of some sort. It is important school districts have a policy and procedure in place to prevent, assess the risk of, intervene, and respond to youth suicidal behaviors. The importance of having that policy in place is to protect the health of all district students. The district should recognize that physical, behavioral, and emotional health is an integral component of a student's educational outcomes. Also, the district should further recognize that suicide is a leading cause of death amongst young people. The district also has an ethical responsibility to take a proactive approach in preventing deaths by suicide and acknowledge the school's role in providing an environment which is sensitive to individual and societal factors that place youth at greater risk for suicide, and one which helps to foster positive youth development. Also, this act will encourage districts to have mandatory training for all staff. Annual professional development will be mandatory to be held on risk factors, warning signs, preventative factors, responsive procedures, referrals, postvention, and resources regarding youth suicide prevention. For those of you who do not have a youth suicide prevention program, you are strongly encouraged to develop an age-appropriate, student-centered educational materials to be integrated within your curriculum for all K-12 health classes. The content should include the importance of safe and healthy choices, coping strategies, how to recognize risk factors and warning signs of mental disorders and suicide in themselves or perhaps others, as well as help-seeking strategies for themselves and others, including how to partake in school resources and referring friends for help. Now, I want you to know that in order for you to develop a procedure, you should be aware of definitions and what they mean. I will go through the following terms, and they're important to include those within your policy and procedure. The first term is at risk. A student who is defined as high risk for suicide is one who has made a suicide attempt, has intent to die by suicide, or has displayed a significant change in behavior suggesting the onset or deterioration of a mental health condition. The student may have thought about suicide, including potential means of death, and may have a plan, which basically means a method or what they may do with said method. In addition, the student may exhibit feelings of isolation, hopelessness, helplessness, and the inability to tolerate any more pain. This situation would necessitate a referral. The next term is mental health, which is a state of mental and emotional being that can impact choices and actions that affect wellness. Mental health problems include mental and substance use disorders. Suicidal ideation is thinking about, considering, or planning for self-injurious behavior which may result in one's death. A desire to be dead without a plan or intent to end one's life is still considered suicidal ideation and should be taken very seriously. The next term is suicide attempt, which is a self-injurious behavior for which there is evidence that a person had at least some intent to kill him or herself. A suicide attempt may result in death, injuries, or no injuries. A mixture of ambivalent feelings, such as the wish to die and desire to live, is a common experience with most suicide attempts. Therefore, ambivalence is not a sign of a less serious or less dangerous suicide attempt. The next term is suicide, which is a death caused by self-directed, injurious behavior with any intent to die as a result of the behavior. The term self-harm refers to a behavior that is self-directed and deliberately results in injury or the potential for injury to oneself. It can be categorized as either non-suicidal or suicidal. Although self-harm often lacks suicidal intent, youth who engage in self-harm are more likely to attempt suicide. Suicide contagion is a term referring to the process by which suicidal behavior or a suicide influences an increase in the suicidal behaviors of others. Guilt, identification, and modeling are each thought to play a role in contagion. Although rare, suicide contagion can result in a cluster of suicides. The next term is risk factors for suicide. That is, characteristics or conditions that increase the chance that a person may try to take his or her life. Suicide risk tends to be highest when someone has several risk factors at the same time. We will talk further about this later on. Risk assessment is an evaluation of a student who may be at risk for suicide. This should be conducted by a school psychologist, school counselor, or school social worker. These are the most appropriate school staff to partake in this assessment. This assessment is designed to elicit information regarding the student's intent to die by suicide, previous history of suicide attempts, presence of a suicide plan, and its level of lethality, including gun, hanging, knives, and others that could be used as a method of suicide. This also looks at the presence of support systems and level of hopelessness and helplessness, mental status, and other relevant risk factors. These are all important pieces of the assessment. Postvention is a term referring to suicide postvention as a crisis intervention strategy designed to reduce the risk of suicide and suicide contagion. Provide the support needed to help survivors cope with a suicide death. Address the social stigma associated with suicide, and disseminate factual information after the suicide death of a member of a school community. Now, when taking into account the aforementioned definitions and the Jason Flatt Act, I was able to do a little research and come across what were the best practices in schools. I found many common themes amongst my research online and various articles. Some of these commonalities were encouraging schools to form a suicide prevention task force, which could review incidents, develop policies and procedures, as well as preventative training programs. If you do not have anything like that, that would be a good place to start, establishing a task force. Also, schools need to have a bullying and suicide prevention program. The rationale behind that is that there is a strong correlation between suicide attempts and bullying issues. It is important that districts are aware of the factors surrounding bullying as well as the factors surrounding suicide attempts. Both programs should be available in your school. According to the State of Texas 84th Legislative Session, Texas school districts are required to include suicide prevention within the campus improvement plan. New employees are required to receive suicide prevention training as well as annual training provided to all existing employees. These best practices will be a helpful resource. One thing about the training that is important is that you need to know what suicide looks like. But as part of best practices, you need to understand what direct and indirect comments look like. For example, direct comments are more like, "I will kill myself," "I want to die." These are direct pieces of information. Indirect comments are more like, "I want to sleep forever," "I want to meet my grandma in heaven," "I wish I could sleep forever." Those are indirect comments about suicide or even self-harm statements. It is important that you are familiar with those because those comments must be reported. Every student, every time, which means any student that makes any type of statement must be reported every time they occur. Again, every student, every time. Those are best practices. I was looking at the website for the SPRC, or the Suicide Prevention Resource Center. This organization has a wealth of information available to the public that you can check into yourself. This organization really believes that suicide is most effectively prevented by a comprehensive approach that has 7 strategies involved. The strategies are as follows. If you think about your school and the students who are at risk, those are likely the students who are struggling in school, perhaps come from a traumatic background, or other risk factors. Identify those students and keep an eye on them. Also, increase help seeking. In your schools, do students know where they can go for help? Do they know what to do if a situation arises? So increase those help seeking behaviors. Thirdly, providing access to effective mental health care. That's very hard to do. And the reason why I say that is because here in the state of Texas, although some of the larger cities may have mental health services out there, it is really sad to say that there is limited access to mental health services. But like they said, comprehensive is best practices. But you need to find some mental health services somewhere. Some is better than nothing. So providing access to that. Also, establishing a crisis procedure. That means knowing what to do in a crisis, knowing who to contact, whether it be parents, when to call 911, and other types of crisis procedures, which are important to establish to ensure that every person involved will know what to do. Another one is restricting access to lethal means. What that means is that if a student were to tell you, I want to shoot myself, and they say they have a gun at home, or they have access to a gun, or perhaps access to a knife somewhere, it is important that you find a way to restrict the access to that means or method. For example, if a child says, I have a gun at home, perhaps you need to reach out to the parents and warn them to keep an eye on the child or lock up the weapon and restrict access. Another one that's important is to enhance life skills. Oftentimes, many students who are struggling may have a deficit in some of their life skills. I oftentimes see students who perhaps don't know what to do, have a lack of coping skills, or gaps within their learning. Therefore, enhancing their life skills enhances their resiliency and ability to cope better. Last but not least, encouraging social networks and connection. Connections are very important for students. Students without connections can lead to greater feelings of isolation. Isolation can lead to negative thought patterns that can spiral into a dangerous situation. Connections lead to better outcomes for everyone.